you have given birth, the maternity staff will offer you support whilst you adapt to life with a new baby. This covers areas of your physical health as well as your emotional well-being and learning some parenting skills that may be new to you. If you and your baby are well, you can go home straight from the labour ward, or alternatively you may transfer to the postnatal ward. Postnatal care is also delivered when you get home, and your community midwife will arrange this with you. You will receive advice to assist your recovery from giving birth. We emphasise good hand hygiene to help prevent the risk of infection at a time when you can be more vulnerable to this. If you have had stitches to your perineum or have a caesarean section wound, a midwife will observe these for signs of infection. You will also be asked regularly about your vaginal bleeding, bladder and bowel function as part of ensuring your body is recovering, as we would expect. If you are planning to stay with us on the postnatal ward for a while, you may want to familiarise yourself with the visiting times so you can make your family and friends aware of these. We do have some quiet times on the ward when we would expect only your chosen companion to be with you, or other children if you have any. All visitors, including your birth partner, would be expected to use the main visitors car park at the front of the hospital once you are on the postnatal ward. All new babies receive a red book known as the Child Health Record that follows them through to adult life. Your child is likely to receive some of their initial health checks whilst you are in hospital. You should have received an information leaflet at booking about all the national screening tests for you and your baby. The hearing screeners and paediatricians or specially trained midwives are on the ward every day to perform these checks. If you have gone home straight from the delivery ward, we will make sure these checks are still arranged for you. Within a couple of weeks of being home, you will be contacted by a health visitor who will guide you through the National Child Health Programme over the forthcoming years. Before you leave the hospital, we will give you information about safer sleeping, registering the baby's birth to get a birth certificate, registering the baby at the GPs, and when to expect contact from your community midwife. You will go home with purple postnatal notes. They are similar in style to the green pregnancy notes, but there are two booklets, dark purple for mum and light purple for the baby. The purple notes contain lots of useful information, and the contact details for your community midwife, GP and the hospital will be on the front of these. We will also give you information leaflets relevant to you and the type of birth you have had. We give you lots of information verbally, but it is useful to also have this in written form for you to review in your own time. Importantly, we discuss with you before you go home signs and symptoms for both you and the baby that may indicate you need to seek further advice from a health professional. As part of our role in promoting good health, we will discuss and remind you about screening for cervical cancer, self-breast examination and contraception. Your community midwife will discharge you from midwifery care at some point beyond 10 days after you have given birth.